This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about a common pickleball injury in the meniscal tear. If you like this video, we put out new content weekly, so please like and subscribe. So, pickleball, racket sport. Can't say I've played it myself, but a lot of people are playing it. The population that plays it tends to be a little bit older, and so with any sport, it doesn't really matter the age people get injured. So, meniscal injury. So you can get meniscal tear in sort of any sort of sport. So how do you get a meniscal tear? So the meniscus, you have two of them on each knee. You have a medial one on the inside and a lateral one on the outside, right? So 4 total in both of your knees. And generally, there's shock absorbers between your femur, which is kind of curved, and your tibia, which is kind of concave. So they make it so the surface is nice and so that you can get evenly distributed stress. So you can injure them usually when you're squatting or bending and your knee is twisted. So when your knee bends more than 90 degrees, it puts pressure on the meniscus. If your knee is twisted when you're bent more than 90 degrees, then that'll put even more pressure on that, and then sometimes it can tear the meniscus. So if you want to avoid getting a meniscal tear, you definitely want to avoid bending your knees past 90 degrees and twisting them. And if you're pickleball and you're running around and you take a misstep, it's possible you could do that. So with meniscal injuries, there's different types. If you get a big one, it's called a bucket handle tear, where part of it kind of comes off like a bucket handle. That needs to be fixed and repaired. A lot of people are walking around with these horizontal or vertical tears, and they're painful. And if they're painful and physical therapy hasn't worked, injection hasn't worked, then you can get surgery where they kind of trim it away. If it's torn in a certain space, then you can actually repair it, but it depends on where it's torn. Now, there's also a type of meniscal tear, and it's called a posterior root tear of the medial meniscus. It's just a location on the inside of the meniscus towards the back. It's a very common area for degenerative tears. So if you are on the older side and your knee hurts because you were playing pickleball and you get an MRI and it shows a posterior horn medial meniscus tear, that may have been there from before you injured it. Now, it may be hurting now because you irritated it. If that were me and I had one of those tears, I would just inject it and let it sit for a while and take some time off. I wouldn't jump right to surgery. There's not great evidence that shows that assuming you have that tear, that doing knee scopes on degenerative findings really buys you that much time. So I think in my case, if I was young and had a pristine knee and I had a big tear in the meniscus, I'd get it fixed. But if it was that tear and I was older, I probably would leave it alone, at least at first. But again, generally speaking, if you want to avoid it, just avoid twisting your knee and bending more than 90 degrees. No lunging short of shots. That will probably help. So I hope I was able to answer your questions about a common pickleball injury and meniscal tears. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any medical advice about your condition, because this video and all my videos are for educational purposes only. Thanks for watching.